NCERT Exemplar 2 Reproductive Health. The method of directly injecting a sperm into ovum in assisted reproductive technology is called GIFT, gamete intrafallopian transfer, ZIFT, zygote intrafallopian transfer, ICSI, intracytoplasmic sperm injection, ET, embryo transfer. Among these, it is asking about sperm into the ovum assisted reproductive technology, which sperm directly injecting into the ovum, we can say ICSI, intracytoplasmic sperm injection. We can call it as intracytoplasmic sperm injection. Okay. Increased IMR and decreased MMR. IMR, infant mortality rate, MMR, maternal mortality rate in a population will cause rapid increase in growth rate, result in decline in growth rate, not cause significant change in growth rate, result in explosive population, result a decline in the growth rate because of the infant mortality rate is increased means that growth rate is going to be decrease. Intensely lactating mother do not generally conceive due to, we call it as lactational amenorrhea in general. A natural method we can say lactational amenorrhea, that around work under nearly 6 months. At the time, what is happening exactly? Suppression of gonadotropin, hypersecretion of gonadotropin, suppression of gametic transport, suppression of fertilization. So, the suppression of gonadotropins like FSH and LH activity, when it is stopped, automatically menstrual cycle is also going to be stopped here. Sterilization techniques are generally foolproof methods of contraception with least side effects. This is the last option for the couples because reason is asking sterilization techniques. What are the sterilization techniques? Vasectomy and tubectomy. Vasectomy and tubectomy are the sterilization techniques. So that why is the last option for the couples they are asking. It is almost irreversible of the misconception that it will reduce the sexual urge or drive. It is surgical procedure of lack of sufficient facilities in many parts of the country. Because of all these 4 reasons, it is going to be the last option. Is the best one, okay, but it is the last option because the people have these kind of some myths like it will reduce the sexual urge. Then it is almost irreversible is almost true actually. It is a surgical procedure that people may get afraid of surgery. Of lack of sufficient facilities in many parts of the country, even that will be the true. A national level approach to build up reproductively healthy society was taken up in our country in 1950s, 60s, 80s, 90s. We are early, we woke up, then that is 1950. Emergency contraceptives are effective if they are used within 72 hours of coitus, 72 hours of ovulation, 72 hours of menstruation, 72 hours of implantation. 72 hours of coitus, that the contraceptive method, emergency contraceptive methods are going to be effective. Choose the right one among the statements given below. IUDs are generally inserted by the user herself. IUDs increase phagocytosis reaction in the uterus. IUDs suppress gametogenesis. IUDs once inserted need not to be replaced. So, intrauterine devices like copper T, copper 7, multi-load 375, hormone releasing IUDs are also called IUDs. Progestin surge. CERT is one of the IUD, LNG20. So, what they do exactly, here in the given option, they are giving about copper releasing IUD. Copper releasing IUDs increase phagocytic reaction in the uterus. Following statements are given regarding MTP, medical termination of pregnancy. Choose the correct options given here below. MTPs are generally advised during first trimester, that means 3 months. MTPs are used as a contraceptive method. MTPs are always surgical. MTPs require assistance of qualified medical doctor, medical person. Yes, MTP require doctor, that any individual person can't do. So, advised during first trimester, this is also correct. So, I select 1 and 4. 1 and 4. From the sexually transmitted diseases mentioned below, identify the one which does not specifically affect the sex organs. Syphilis, AIDS, gonorrhea, genital warts. Among them, the AIDS, acquired immunodeficiency syndrome. Acquired immune system, T lymphocytes and macrophages are the victims in this case. Hence, we say they don't have any effect on the reproductive organ, or they may have, but not a direct effect, we can say. So, it is that AIDS, HIV virus is a genital, not a genital disorder, sexually transmitted disease, okay, but doesn't directly affect sex organs. Condoms are one of the most popular contraceptives because of the following reasons. They are the effective barriers for insemination. They do not interfere with coital act. These help in reducing the risk of STDs, sexually transmitted diseases. So, all these are going to be the reasons here. So, that is our option is all of the above. Choose the correct statement regarding the ZIFT procedure. Zygote intrafallopian transfer. Correct statement regarding ZIFT procedure. ZIFT means zygote intra, when you know full form, automatically you can answer easily. Intrafallopian transfer. Zygote intrafallopian transfer. Okay. So, ova collected from a female donor transferred to the fallopian tube to the facilitate zygote formation. No, that's wrong. Zygote is collected from a female donor and transferred to the fallopian tube. Zygote collected from a female donor, okay, and that was transferred to fallopian tube. That is the right answer. Zygote collected from a female donor transferred to the uterus. This is wrong here. Ova collected from a female donor and transferred to the uterus. This is even wrong here. Okay, so what is our answer? Second option. Zygote is collected from a female donor and transferred to the fallopian tube. We call zygote intrafallopian transfer. Correct surgical procedure as a contraceptive method is ovarectomy, hysterectomy, vasectomy, castration. So, vasectomy and tubectomy are said to be the surgical contraceptive methods. Vasectomy in male, cutting vas deferens, tubectomy in female. Diaphragms are contraceptive devices used by the female. Diaphragm, cervical caps, valves, female, we call it as barrier method. Choose the correct option from the statements given below. They are introduced into the uterus. They are placed to cover the cervical region. They act as physical barriers. They act as spermicidal agent. So, in these, they are introduced into the uterus. No. They are placed to cover the cervical region. Yes. They act as a physical barrier for sperm entry. They act as a physical barrier for sperm entry. Yeah, they are the physical barriers only. They act as spermicidal agent. No, they, along with them you can use spermicidal agent. So, what is our answer then? 2 and 3. 2 and 3. That's it. Reproductive Health, Exemplar Biology 12 from Icon Educational Institutions. Thank you.